a lot of criticism have been trailing the Cross River state approach in curbing the spread of COVID-19.
Autumn School of Thought believes that the amount invested in the fight against the virus in the state is just too much.
All right, other states welcome development in preparedness and readiness of the pandemic, which is yet to hit the state. So joining us now on matters arising from COVID-19 pandemic preparedness in Cross River State is the Commissioner for Health in the state, Dr. Betta Edu. It's a pleasure talking to you, Dr. Edu. How prepared is the state for all of this happening as we speak now? Because Cross River State is quite strategic. You are bordered with another country, Cameroon.
Pleasure to be on Arise News. Basically, it's time for us to very clearly discuss the issues as it concerns COVID-19 in Cross River State. I'm sure, like you very well know, Cross River State has started long before most other states in Nigeria started to ensure that we can prevent COVID-19 from coming in through our borders. Basically, Cross River State was one of the first states in Nigeria that started screening people who were coming to our local borders or through our local airports in the state. So anybody who was coming in from Lagos or Abuja, we would screen you and then, of course, look out for those symptoms which persons with the disease would have. We were one of the first states in Nigeria to have completely shut down our borders. We shut out the disease because we didn't have, of course, cases in the state or any case in the state. And so we had to ensure that our borders were shut, both the international border and the interstate border. Remember, we are at a very strategic position, and that's why Cross River State has to be isolated and treated as such. We are bordered by Cameroon to the south. They have over 600 confirmed cases of coronavirus. On this other way, to the right, to the left, we have, of course, down south, Akwa Ibom State that has 5 cases. We have Benue up north that has 1 case, and several other issues surrounding it. Of course, the eastern states, which are close to Cross River, have also recorded some cases like the Enugu State and the rest of them. And then at this point, for us in Cross River State, our #1 strategy is prevention. A lot of work has been done around prevention, and we want to see that we can continue to keep our delicate state COVID-19 free. The state of preparedness continues to improve every other day. But like I said, our #1 idea is to see that we can prevent the disease from coming into our state. Several things have happened in the course of the event of this outbreak of COVID-19 since January up to this point. The first point was that we set up an EOC, which is an Emergency Operations Center in Cross River State, which had both, of course, a strong team of both professionals, those in the military, paramilitary, and indeed everyone on the line to help support this fight. We started very early sensitization across the state, the hinterlands, in rural areas, engaging chiefs and gatekeepers to be part of this fight to ensure that people know more about COVID-19 and how they can prevent it. We have also seen strong force by the governor of Cross River State, even going to spend the night over at the border to ensure that we can stop those who are sneaking in from coming in. And right now he has deployed commissioners to all the borders to man them, working with the task force and the security team to see that we can keep our borders safe. Of course, this has not left out the fact that we have been able to put together 2 isolation centers and planning to build some more at the border points, at least quarantine centers where people can just stay. For us, the approach to fighting the COVID-19 in our state is a 360 approach. It's all encompassing. So we're not just looking or waiting for the disease to come for us to now treat the disease or manage patients. #1, we're trying to keep it out of our borders. We're also planning for any eventuality. The governor has released over 50 cars that will support the task force to be able to maintain all the policies.
Dr. Edu, if I can come in here. Given the spread and the transmission mode, we do know that majority are asymptomatic, meaning that they would not show symptoms even though they are infectious with this disease, and so anything is possible. But let me ask you 2 questions here. First and foremost is the no mask, no movement strategy, which your state has put in place. Can you guarantee that every Cross River citizen along the 18 local government areas would have at least a mask? And I want to know how many is given per individual or per household. And secondly, as the State Commissioner for Health, are you worried that you may be, your message, your preventative message, may be different from that of the Nigerian Center for Disease Control, and by extension, the Nigerian government?
Okay, so first I want to take us carefully through this. The Cross River State government produces this masks at the garment factory. These masks, they are 3-layered, of course, good layers, and then the filter in between, which is what everyone is expected to use if they must leave their homes. Remember, the rule number 1 is to stay at home. No public gathering at this time, no church, no burial, no wedding. None of these activities should be holding. Everyone, no school is open. Everyone is expected to stay in their houses. That's the number 1 rule. But should you go out to do anything, should you go out to go to the market to buy food, drugs, whatever it is, or to seek some form of livelihood, then you must be able to use a mask. Remember, right now in Nigeria, we're going through a storm. You're beginning to see states that are on complete 100% lockdown having issues with mob coming out to say, look, we don't have food to eat, we don't have things to eat. Over a month ago, the governor of Cross River State has stated it very clearly. And he said a complete lockdown without a support or a policy to support livelihood and people continuing to maintain themselves over time would definitely lead to catastrophe in society. And that's what we're beginning to see in places like Lagos, of course, the Agege and the others that you have been showing all day. So for us in Cross River State, we have produced over 1 million masks, and the governor has said they should continue production. They work 24 hours in 3 shifts, and they try to do this. Of course, you've seen videos of the governor going there even late at night at 12 midnight to see them. He provided special incentives for them. They have been paid 3 months' salary at a stretch, and of course, they have been given food for each shift and drinks that they have to. They have access to all of this just to encourage them to continue to produce. We want to produce about 4 million face masks that would be given to Cross Riverians across the 18 local governments so that they can comply with the no mask, no movement. Remember, this mask is completely free. You're not supposed to pay a dime for it. That's number 1. Secondly, for us as a country and for us as a people, it's very easy to understand this. Our culture in Africa is difficult to maintain the 1 meter apart, which everyone has said, okay, maintain physical distancing from people. It's great, it's theoretically great, but being practical, are people able to practice this? The woman who is in the market, the person who goes to the bank, even the cash transfer, the conditional cash transfer that is going on now all across the state. People still come out. They go to places to give food for welfare. Of course, you know the government of Cross River State is providing food to be distributed to people using the World Bank register for the poorest of people in society. They're using this to distribute food all around the state. When you go to do this, trust me, people don't want to wait in their homes for you to come. There's this general feeling that you might never get to the doorstep. So let them come and try to see how they can get this thing before it's finished. That's the general mentality. And so when you see our day-to-day movement, our day interaction, you can see even when people are patting themselves on the road. Do you see people keep 1 meter apart from themselves? No, that's the truth, and it's practical. You see it every day. Even when we stop the banks from saying you cannot take in more than this number of persons at the same time into the banking hall. The rest of them are outside the banking hall, crowded there, and you're trying to disperse them, and they say they need to get money. They need to be able to continue to live. And so we're saying, if you use a mask, I use a mask, both of us can contain whatever is coming out of our mouths when we talk, when we sneeze, when we cough. Remember the simple physics, velocity. When you sneeze or you cough or you speak loud, you emit micro droplets, okay? But if you're using your mask, of course, it's going to contain it within you. These droplets will not go onto surfaces where people can easily touch, then touch their nose and transmit to the next person. At the same time, you can see even at the national, when they go to public places, even though they are maintaining the social distancing, they still use the mask. Why are they doing it? It's simple to be able to protect themselves.
Okay, I'd like to come in here. It's very interesting that you would make this point. So it's very interesting that you make this point, talking about how people find it difficult to maintain social distancing. And as it stands, Cross Rivers is yet to record any case of coronavirus. And the governor of Cross River State, Betta Edu, has come out to say that as of the 14th of April, which is tomorrow, Tuesday, civil servants from grade level 10 in the state should resume work. So are you saying that you are fully prepared? Have people been enlightened? Because even in some of the video footage that we've seen, there are people wearing masks. However, they don't cover their nose properly. They're still touching their faces. They still touch their eyes and their ears. So if people are returning to work, doesn't this defeat the purpose of social distancing?
So this is one of the strongest things which the task force is doing presently. At the whole of Easter yesterday, I didn't spend a minute with my family or at home. We're out on the streets trying to ensure that our people can use their masks, of course, and protect themselves and use it correctly. Remember, there's a fine in Cross River State. There's a law backing it such that if you don't use your mask or you don't use it correctly in public spaces, you get to pay a fine. You get arrested for it. And we put you in a quarantine center until 14 days is over, because we need to be able to protect our people, of course. The reason for bringing people back to work is simple. By the end of this month, we'll need to pay people, isn't it? We'll need to be able to provide for people to continue to sustain them at home, isn't it? And so if there's no workforce to be able to carry out this assignment, then it becomes difficult to pay people funding, people run short of money, and then everybody begins to shout, and then you have that mass movement on the streets saying, we don't have money to go buy food in the market, or even to buy drugs for ourselves at home. So as we are concentrating on the public health aspect, we must be able to concentrate on the welfare of the people, the livelihood of the people, or else we're setting up society for a complete disintegration and, of course, chaos.
Okay, I'd like to ask you, how prepared in terms of palliative is the Cross River State government for the people of Cross River? I'm excited you talked about what is happening in Lagos, and it's only a matter of time. This will permeate through the state because there is pervasive poverty in the land. How prepared is the government for the people in terms of palliatives?
Okay, so there's a lot that's been put together right now. First, I said we're making the masks, okay, and it's going to be distributed. We're also making hand sanitizers that are going to go out. And then food items are, of course, being packed as we speak. Tomorrow is going to be launched, and then every household will receive. Conditional cash transfer has already started at different parts of the state. And beyond that, the governor has also...
Sorry, how much are they receiving as conditional cash transfer? How much are they receiving? How much are they receiving as conditional cash transfer?
Okay, so basically there are different categories of persons who are taking, of course, from 5 to 15,000, and then some are getting as much as 20,000 naira. But like I said, it's not to the general public, but it's just to homes that have been identified as being in the lowest quintile of society. Remember, there was a World Bank register that was made before this time, which was devoid of political interest or any social interest. And we're going to hop on this World Bank register to be able to distribute both cash and, of course, food items to people. We want to see that we can do some more in the urban centers and also in the rural areas too, where people may not be able to have access to food, and I'll have access to all of these items which they need at this time to encourage them to continue to stay at home. We preach that people should stay at home. Home is the green zone and is the safest at this point in time. But if you must come outside, if you must use public transport, if you must use the public places, you should wear a mask to protect yourself.
COVID-19 has come to change the way of life, including broadcasting for broadcast media such as ours as well. We're trying to reconnect with the Commissioner for Health from Cross River State, but she was making that point repeatedly. You know, the state has actually taken a stand about how to prevent COVID-19 in the state, which is the no mask, no movement. We're beginning to see a lot of states and countries globally also do that But the debate here is that the only preventative measure that the state is adopting? The governor made that comment, which has gone controversial. And we saw the NCDC boss, because Arise News actually brought it to the notice of the NCDC at that daily briefing. It was Amaka from Abuja Studios who asked him, and he said, you know, let the political leaders allow the experts to do the reporting, because when it comes to COVID-19, there's a lot we do not know. Definitely. And so the little that we know, let the experts explain to the people. So when you tell people no mask, no movement, is that the only message? I think that would be my next question to her. Yeah. What else are you telling the people of Cross River to do? She's saying stay at home, but if you must come out, use a mask.
I mean, it's a potpourri of a lot of ideas, and we have to be very careful. Like you said rightly, the only go-to source should be the ncdc.gov.ng during this period. I mean, because what works in other parts of the world might not work for us, and NCDC knows what works for us in Nigeria. A lot of people have made the argument. They've said, oh, Sweden is not locking down. There's no even social distancing, which I rebutted. I said there's even social distancing in Sweden and the likes and things like that.
But they forget Sweden is doing herd community.
Herd community. But we shouldn't make those arguments. And in all truthfulness, the political class too should help to ensure that the people to follow what NCDC says. And NCDC should take charge of this. NCDC should be the modus operandi all over the country. As regards how we deal with it.
Yes, indeed, we do hear that the Commissioner is back. Thank you for staying with us. We do understand that these things will happen once in a while with communication. But let me ask you, first, what other preventative measures are you telling Cross River's citizens to adopt at this time beyond the stay at home, and if you must come out, use a mask? Secondly, the last census in 2006 did put the population of your state over 2 million people. And you have said in the course of this conversation that over 1 million masks have been produced. My question then is, disposal of these used masks, how are they being disposed? Because we also know that that is a very potential petri dish being disposed.
So the mask that is being produced by Cross River State is ongoing. Like I said, we will continue to produce more and more masks. They're running a 24-hour shift. The mask is reusable. Okay, they're reusable. We've left the surgical masks, the medical masks for the health workers, which have been given across the state. But for the other population, the mask is reusable, and we've told them what to do with the mask. When you're done with each use, you must wash using warm water and, of course, the right detergent. And after that, you should iron them before using them again. So they're reusable and they can be recycled, okay? So it's not like it's a use and throw or use and dump. But if you're using the surgical masks, you should be able to properly dispose of them in a proper closed, tightly closed refuse bin in your homes. And of course, like you had rightly asked, there are several other measures which we are using in Cross River State to ensure that we continue to keep our state COVID-19 free. Remember that last week we sent in 3 samples to Irua, which is the reference lab for testing, and they came back all negative. And since then, we have not had people who meet the criteria to send their samples again to the lab. When we find such, we would send. Like I said, they would ask people to wash their hands over the course of this period. There have been a lot of boreholes being fixed for people in public places, which would help them have more access to water, especially when they're out of their homes. The water board is still providing water to the urban areas. And of course, in the rural areas, they are expected to use water to wash their hands as often as possible. I told you of the over 500,000 hand sanitizers which the Cross River State government has produced. And we are distributing this free of charge to people so they can also use alcohol-based hand sanitizer when they are out of their comfort zones. Beyond this, we've also advised people that they should try to report anybody who is sick, who is coughing, has headache, of course, fever, or any of the symptoms which has been associated with the COVID-19 outbreak in Nigeria. Above that, Cross River State government has also said that when you sneeze, if you do sneeze, of course, and you are probably at home, you should either use the flex of your hand or use a tissue paper and dispose of it properly into a closed, tight bin. So several other measures are being put in place to see that people can continue to keep safe and to keep free of the COVID-19.
Yes, thank you, Commissioner. I mean, you have mentioned a number of preventive measures that Cross River State is taking, and I do commend you on that. However, I would like to talk about testing. As it stands, like I mentioned earlier, Cross Rivers definitely hasn't recorded any cases yet. And Adesua has also mentioned that you have a population of 2 million people. As it stands, Nigeria has 30,000 testing cases.
Over 2 million.
30,000 test kits. So I'm curious to know how many tests have been conducted in Cross River State, and how many more do you intend to do even as the days go by?
Okay, so as instructed by, of course, the NCDC and the Federal Ministry of Health, they're asking us to test people who have presented with symptoms to us. Of course, when these symptoms are found, either in the community or anywhere, they're supposed to call the toll-free lines or get across to the nearest health facility or call the DSNOs, which are the disease surveillance and notification officers, to be able to come down there and take samples. Health workers are being trained, and training is ongoing. We do drills at the isolation center every day. Ambulance drivers and the rest of them have been trained to be able to respond to this. And so when we have cases of people who have symptoms or believe they have been exposed, we take samples and we send them to IRWA. Like, you know, initially Nigeria had only 6 reference labs where you can test for the COVID-19. And we are not allowed to use the rapid test kits. It's not allowed, or it's not confirmed to be used in Nigeria. The sensitivity is quite low, it's below 30%. And so the Nigeria cannot depend on it to get results, because you get many false negatives and all of that. So that's why we have to send samples. So far, we've sent 4 samples to IRWA, and all of them have come back negative. And these are samples of people who have shown any sign, or people who have given us any history of previous travels, or people who have been in contact with people who travel.
Commissioner, if you can hear me real quickly, I know this has been, you know, a very toughest time for all of us. There's been a lot of back and forth. Even there's been a lot of reactions, you know, based on, you know, the advice of the governor, and it's been, you know, a very, you know, heightened period. But just to douse the flame, you know, of whatever might have happened, and, you know, to cut the governor some slack, a lot of people will reckon that the governor is doing quite a good job, you know, at this point in time. And the question is, you know, how is he taking in all of this? How is this period like for the governor?
Well, for him, he's been a sacrificial leader. He's been on the front line. I'm sure we all know he's a professor of microbiology, and he's done a lot of extensive work on virology and all of that. He's been on the front line. He's been very, very supportive. He has not held back on finances. He has not held back on even being at the front line. The governor of Cross River State slept at a border through the night into late hours of the morning, just because he kept getting reports from that border that people are crossing from one state into another state. Today, the governor is also going to an international border where we have gotten some reports of persons trying to get in at all costs. And he's going there himself. He's been a leader leading from the front. He's been very, very supportive, even, of course, working with community leaders, using his influence on traditional rulers and the rest of them to see that they are part of the full team that's responding to the COVID-19. It will amaze you to know that in villages, especially in the border villages where we border Cameroon, communities, local communities have formed vigilante, and they are manning these borders together with security agencies to see that no one comes in from Cameroon to come into our state to infect people in our state. So this is how engaging it's been. Of course, there's going to be a lot of back and forth. There's going to be a lot of criticism when things are put out on the plate. Initially, everybody will say, oh, why this, why that? But it takes some time to sink. And then when we come to the reality, we get to understand that truly we must be able to bring out policies that work, policies that are practical, that can help our people and help the state sustain its COVID-19 free status. It's a lot of work, and for him, he's on the front line. He's been engaging. In fact, it's been a very, very rewarding experience. I'm sure for all of our lifetimes, this might be the one and only global pandemic that has hit not just Nigeria, but the entire globe.
Indeed, I do agree with you that with COVID-19, it's not a one-size-fits-all approach. And so it's best to choose that which, is practicable for you. But very quickly, before we let you go, are there any demands that you need as a Commissioner for Health in the state to prevent and respond should you eventually get this case from the government or from the federal government at this time?
So for us, we are looking forward to the support from the federal government. We've raised this with the chairman of the Presidential Task Force, and we hope that he would be able to get our demands across to the federal government to support Cross River State at this point in time. The governor had clearly stated that the federal government should treat Cross River State as a special case. We're surrounded by every other person who has one issue or the other. And of course, the Cameroon border, which stretches so long through the state. So it's a whole lot of work, a whole lot of financing, keeping people at that border to continue to watch over it every other day, being supported, of course, by the security agencies. It's a lot of work, and the federal government needs to step in to support us. We've had very, very little, if not no support from the federal government at this point, and we are expecting some support from them. Of course, highly good-spirited individuals can come in to help the state. This is not a fight about Ayade. This is not a fight about party. This is not for persons. This is a virus pandemic that's against humanity, and everyone must come indeed together and stand.
Well, Madam Commissioner, we'll take a break now. We'll be right back to talk some more about Cross River's preparedness for COVID-19 as the state remains one of the 17 in Nigeria yet to record a confirmed case. Stay with us. We'll be right back. Welcome back to the Morning Show here on your Rise News. We still have with us from Cross River State, the Commissioner for Health, Dr. Betta Edu. Thank you so much for staying with us, Dr. Edu. And I was asking, you were responding to that question when I asked if you had any demands from the state government or from the federal government at this time. You had touched on securing the borders because of the strategic location of your state. But beyond that, are there any other demands?
Of course, there's several other demands which we'll be asking the federal government to support us at this point in time. Remember, like I said, we have several border areas across the state, and so we need to quickly set up quarantine centers in these border areas across the state. So people who, for whatever reason, had come into the state before this time, we can all keep them in there for at least 14 days. We need to be able to expand on the present isolation center, which we have. We also want the federal government to quickly come into Cross River State and set up the reference lab where we can carry out testing for COVID-19 in our dear state. Remember, in the whole of South-South, there's only one functional lab, and that is at Irua. If you have to send samples from Cross River to Irua, it takes almost a full day to do that. And so we need the federal government to quickly come through for us and help us to set up those centers in Cross River State so we can carry out our own testing at this level. Like I said earlier on, the federal government needs to support the production of masks, which the state government is presently carrying to be able to provide protection for its people. Even for other people outside Cross River, they can use this mask. They are made with 3 layers, like I said, with filters, and they can be able to keep to a confinement the number of micro particles or micro droplets that would come out from our mouths when we're speaking loud, we're coughing, or we're sneezing. And of course, if 2 people are using this mask and they come even close to themselves, definitely, if any microorganism come through the first mask, it would have lost velocity and would be unable to get into the next mask to infect the next person. So really, we need all of this support. We also would need support for farmers at this time. Remember, it's a 360 approach. Nigeria as a country should be able to feed its citizens at this point in time where all our borders are closed. So for my governor, providing for livelihood is very, very important. And that's why he sent out rice seedlings for farmers to continue to farm and produce food, not just for Cross River State, for the rest of Nigeria. So we need all of this support from the federal government to continue to push as a state.
Yes, definitely. Thank you, Dr. Edu. And we did start this interview without even wishing you a happy Easter. I know this is Easter Monday,
true.
and throughout the weekend, we did see different states celebrate Easter in ways that they could from their homes. Now, I'm curious to know what the weekend was like in Cross River State, even during this holiday that we had to celebrate from our homes.
Yes, I'm sure for the first time in my lifetime, I had to see people sit at home to celebrate Easter, not by choice, but because we cannot afford to gather anymore in our dear state. And I'm sure it is touching for many Christians all across the state. But the kind words of the governor, Senator Professor Betta Edu, I'm sure will suit their souls at this moment, where he said, really, everyone should return to God because he holds indeed a solution to end this pandemic all over the world. We need to return to God. Of course, for Christians, it was a tough time. Some persons outside Cross River State and Nigeria have lost their family members to COVID-19, and indeed, we sympathize with them. For us in Nigeria, in Cross River State, we continue to encourage people, please do not distance yourself socially from your family members. So this is not the time to cut off all forms of communication.
Okay.
Follow what is acceptable at this point in time, reach out to people and support people emotionally.
Okay, Commissioner, I just quickly want to ask, how is the state partnering with neighboring states as regards that neighboring states have got cases of coronavirus? And also, you talked about Cameroon. Is there any, conversation going on with Cameroon as regards, securing entry into Cross River States and the likes? And what has been the engagement like with people? Do people even understand the temerity of COVID in Cross River State as we wrap up?
Sorry, can you take the last part of your question again?
How's the engagement with people like in Cross River State? Do they get the message? Do they get the need to even stay at home? Because a lot of people might not even understand. They might just think they just want to keep them in the house.
Okay, so first and foremost, a lot of sensitization is going on in the state. We have over 3,000 persons who are volunteering, and of course town criers that go around communities to announce and speak to people in our local dialect so they can understand what this is about, how to prevent it, and the reasons why they have to continue to stay at home. It's been a bit difficult to explain what social distancing is, and that's why you can hear my governor clearly say, if you must go out to public spaces, you should wear a mask. Very, very, very important, and it's sacrosanct for us in Cross River State. The reason being that the market woman, like I said earlier on, does not even understand what 1 meter means. She doesn't even understand what 5 meter means. And of course, from time to time, she goes close to her customer to either receive money or give them the items which they've bought. So we keep pushing this message and trying to get people to understand truly how we can prevent this spread and how we can stop it. Our relationship with Akwa Ibom State has been great. We speak to the commissioner in Akwa Ibom State. We help them with a lot of contact tracing, and even the border closure, which was done between Cross River and Akwa Ibom. Initially, they were not closing the border on their own side, so it mounted a lot of pressure on the Cross River side, and that's why the governor had to go there in person, because like we said, we're not shutting in, we're shutting out. We do not have the virus, and so we're trying to shut everyone who could come in to get people infected in this area. Of course, the relationship with Cameroon is more under tension. The reason being that, of course, they are going through a kind of civil unrest in southern Cameroon, where people, before this time, we had over 36,000 refugees and asylum seekers coming from Cameroon into Cross River State. So it's very, very difficult to continue to keep them back there, especially taking into cognizance the fact that they are facing a lot of trials in southern Cameroon right now. And so for us, it's been a very, very tough one, but government has been able to stand up to the occasion. And of course, we're requesting that the federal government do a lot to come in there and ensure that both the immigration, the army, and several other agencies are on top of their game, keeping those borders closed. The president has said the borders have to be closed for now. We've had meetings with UNHCR to discuss where human rights stops and where protection of citizens should continue. It's been a tough one, but we're sure that right now our borders are completely shut, and we want to continue to keep it that
well, it is a lot. It is a lot of work.
The interest of our people. Sensitization will go on and on and on until our people understand this.
It is a lot of work, and we do commend you for what you're doing. Two questions together, if you can answer as briefly as you can. You've talked about your demands or your needs from the federal government at this time, but I want to ask, what is the corporate society doing? Has there been any response from the private sector? Are you reaching out to them? And secondly, we do know some monies have been approved by the State House of Assembly for the response and preparedness for COVID-19. What are the priorities for those spendings? As the Commissioner of Health, how much of that chunk are you getting?
Okay, thank you very much. I think the first point, which was raised about spending or approvals from the Cross River State House of Assembly. This approvals was just made last week, and the funding, of course, has not been released yet. It's still in the process. That's why we went to the House of Assembly in the first place. And of course, this is time where everyone is supposed to contribute, all levels of government is supposed to contribute to see that we can meet the required needs as we go ahead. And of course, this response is total. It's 360. I'm the chairman of the COVID-19 response in Cross River State. And like I said, we have divided the response into subcommittees, which has to do with people's welfare, which has to do with security of lives and property, which has to do with securing our borders, which has to do with the clinical aspects, case finding, risk monitoring, surveillance, case management, isolation centers, management, building up more isolation centers, and the rest of it. Funding will be going to this point too. But for us, our number one strategy is prevention. Whatever we can do to continue to prevent, including sensitizing our people, including protecting our borders, we will continue to do same. We have reached out to several corporate organizations, private organizations to support the state at this time. Some of them have been able to come up with some material support, some bags of rice, pasta, drinks, and all of that, but not much has been done from the private sector, and we are still looking forward to more.
Well, we do hope that they come to your aid, Dr. Edu. Thank you so much for coming to the morning show today, and all the best with your state as you prevent COVID-19.